Record. Hi, welcome to the Elevating Aesthetics podcast. I'm Brittany Perez, your host, and today we have a special guest, Brittany Pollock. She is with Toxcology Med Spa, formerly known as Toxic by Brittany. So thank you so much for coming
Hi,
today.
I'm
I'm
so
obs-
excited.
I'm excited. I'm obsessed with you. So super excited to have you on. So
Mutual.
tell us a little bit about yourself.
Oh my gosh. You're right. Toxicology, Regenerative Aesthetics and Wellness. I just changed that name. I'm rebranding. I have been in aesthetics for almost 5 years now and came into the market as Toxic by Brittany. And that was just something that was spilled upon. Me and my husband were eating lunch one day and I said something stupid, just random, that I always say as a Brittany. I'm sure you can relate. And
Really?
he was like, "Oh, you're so toxic." And I was like, "Yeah, I am. Like, give me all the toxin. Like, I'm okay with that." So then became Toxic by Brittany, and he's always like, "Oh, I need royalties on that." I came up with that name, and it was a
You're
play
like,
on words.
you're
Yeah,
paying for it with the bourbon
yeah.
behind
The royalties are behind me. Here you go, Mr. Bourbon Man. But yeah, I mean, it was just a play on words, and then I love Britney Spears. Bless her heart. We're gonna find her one day. But toxins are toxic. They're a neurotoxin, and there are so many other toxins that are coming onto the market. I mean, there are peptides being derived from scorpion venom, which are toxins.
you.
So,
Interesting.
whereas toxic may have negative connotations, they actually have many beneficial applications. And that's kind of like my slogan and how I relate that name to wellness. But as I have progressed in the aesthetic industry and I've hired people on, I have changed my name to Toxcology. I took out the I because toxicology is kind of related to a death report and things like that. And I didn't want people to think of an aesthetic spa as toxicology. So I took out the I and it became toxicology. And basically, that's the study of being toxic. So it was
I
just a
love
big
it.
play on words, big play on words. So toxicology, regenerative aesthetics, and wellness came along. And, I've
You're
been a nurse for 12 going on 13 years, and I decided to go back to school last year, and I am a year through nurse practitioner school, and I will have my nurse practitioner next August. We're going to pray on that one.
are you doing
It's
the
been a long
FNP?
road. I'm pretty sure that's the one I'm going to specialize in, just because I
Okay.
do a lot of peptide therapy
Yeah.
and everything, and I want to be able to be very versatile in what I do in my spa. But it's been wild because I have a husband. He's absolutely amazing. It's our 6 year anniversary, and we're actually flying out to Vegas in the morning. We go to Vegas every year to celebrate our anniversary. We love Vegas. And we have two children. They're 12 and 5. One just went to junior high today, and the other one just started kindergarten. So that's insane. And I'm just very busy. I have my own business. I've hired a nurse practitioner. I have some estheticians coming on board, and I'll be moving into 3,500 square feet. Eh, that sounds crazy. It's bigger than my house. So there's
That's
just a lot going
huge.
on, but I
That's
never stop. I'm super on the go all the time, and I love what the industry is becoming, and I'm excited to talk with you today about all of
yes. You're so passionate, and I just love that so much about you. So I want to hear like you specialize in regenerative medicine and peptides and weight loss. So a
it.
lot
Yeah.
of people don't know what peptides are. So kind of tell us what made you lean towards peptides and what are peptides?
Yeah, it's so crazy. So both of my parents at 53 and 54 were labeled as type 2 diabetics. And being in the rehab industry for so long, I had my certified rehab registered nurse. I worked in acute rehab for 10 years, and everything I saw was centered around someone being diabetic, whether it was end stage renal or cardiovascular, whatever it was, at the source of it, this patient always had diabetes, because we know as a metabolic functioning system, once you have diabetes, it literally affects every system and organ in your body. So my Nana, who is 75, had a pretty massive stroke 5 years ago. She actually had the stroke, and then I had Lexton. So 5 years ago, and I care for her. I have her in, a home, and she's being taken care of. But then my grandmother also died from end stage renal. So we have a lot of things that run in our family: cardiovascular, kidney disease, things like that. And when my mom and dad told me what their A1Cs were, I was like, you guys, I mean, what is going on? You know, they always make jokes and they say, oh, well, I'm in a nursing home. You want to take care of me. But we know, as the only medical professional in the family, we know that's not going to happen. We know that when something drastic happens, we're going to have to step in and we're going to have to advocate and we're going to have to pull them through the system and the insurance and making sure they go where they're supposed to go. So I was like, no. So I actually was already kind of in talks with these people in Atlanta that I'm with. It's Regen MD, and Elliot Campbell is kind of like the lead head of that. He is the legend, the peptide man. And what I love about their company is they don't just focus on, you know, everybody loves semaglutide, everybody loves tirzepatide, but I am literally injecting near 16 peptides a day into my own system. And so when my parents told me that, I was like, okay, I'm getting in with these people. They have semaglutide. You know, that was what we started off as. This is when the FDA put it on the national shortage list and it was able to come back to compounding pharmacies. And many people don't know that semaglutide is a peptide.
Yep.
And a peptide is a build of amino acids. Our body literally functions off of essential and non-essential amino acids. So it's important to understand that this is the safest form of medication that I don't like to think of it as medication. I think of it as injectable vitamins. It's the safest form that you can provide your body. So I started my parents on that, and within 13 weeks, I had literally saved their lives. You know,
That's incredible.
and it's wild. You'll see cholesterol levels, like the good and the bad will flip, but they'll both be in the green, and that's never been done. You know, all their labs that were in the red are now in the green. My dad's A1C went from a 6.5 to a 5.1 in 13
In
weeks.
13 weeks.
In 13 weeks. But it's
Wow.
important to understand peptides because, yes, is semaglutide amazing? Yes, is tirzepatide amazing? But you shouldn't just go for, you know, everybody's like, oh, tirzepatide works better. Well, there's a reason why. You have dual GLP-1s, and that's tirzepatide. Semaglutide makes your body more sensitive to the insulin you produce. Okay, tirzepatide does the same, but it also makes you produce more insulin. So if your body is already effectively producing insulin, there is no need to stimulate your pancreas to produce more. Because what's going to happen is, yeah, you're going to lose that weight. Most of it's probably going to come from muscle. But once you come off of that, your body's going to say, hey, where's all the extra insulin I was getting? And then you're likely to rebound. So when I bring someone in for a consult, again, I'm just an RN. So I have hired a nurse practitioner, and she's just heavily as invested in peptides as I am because I brought her into the world about 1.5 years ago into peptides, and she looks amazing. Her name's Jennifer Stewart, and you can find her on my Instagram and see her before and afters. They're absolutely amazing. But she's just as involved as I am, and we figure out the bigger picture. And most of the time, are people getting on semaglutide? Yes, but we're even microdosing it now because the benefits of semaglutide are far more than just weight loss. They're cardiovascular, they're anti-inflammatory, they're lowering cholesterol levels. So even if you just want to get on a microdose, but be on other peptides that are going to convert your sugar and make it usable energy. That's what we used to do when we were younger. So it's important to understand that while semaglutide and tirzepatide are great, you need to know which one is best for you and be informed, because of course somebody you go to who only offers the two are going to be like, oh yeah, you're going on tirzepatide, it's great, it's got less side effects, you're going to lose a lot of weight. Well, yeah, there's a reason why. You're putting more insulin in your system to clear out more sugar in your body, and that sugar won't be processed by your liver and it won't be stored as fat, because that's, you know, we have circulatory sugar, we have liver, and then it's stored as fat. So, I mean, I could go on for days about peptides, but it's important for people to just understand that peptides are amino acids, and our body functions off of essential and non-essential amino acids. So as many peptides as you give your body, whatever you want your body to do, you want it to gain muscle, you want to have improved hair, skin, nails, sex drive, muscle mass, endurance, cardiovascular. You want to be tan? Like, I take Melanotan,
Wild.
and it's wild, you know, it's so wild. But Melanotan, it doesn't just make you tan, it's an anti-inflammatory, and it's also an appetite suppressant. And for us, fits 3 and below, it does help us to prevent skin cancer. Like, it's wild.
That's a win in itself.
It's a
So,
win
so
because
first,
that's all we preach about is SPF,
yes,
you know?
yes, it is
So,
skin cancer prevention. Wear your sunscreen. So, whenever you're looking at a patient's chart or you're trying to decide if you're going to put them on semaglutide versus tirzepatide, you obviously lean more into semaglutide. But what would a traditional patient look like if you were like, okay, yes, for this reason, I'm going to choose tirzepatide? Do you start almost everyone on semaglutide and then
right.
see how they do and then transition?
Yeah, so we're definitely going to be checking labs. I mean, we can't say, oh, is your pancreas producing insulin? But we can look at your A1C and we can look at your glucose level. Okay, so if we've got you on semaglutide, and I'm going to be honest, I don't have a single person right now who is on max dose. I have two. I've been doing peptides for 2.5 years, and I have two I have converted on to tirzepatide, one being my mom. And it's because we got them to the max dose of semaglutide, and they were also on a fat burner blend, which consists of three peptides, MOTS-c, AOD, and tesamorelin, and they all have their properties and what they do with the body. But once we got them to that and we knew they were intaking the right amount of protein, we knew they were doing all the things they were supposed to be doing. Because if, believe it or not, if you want your goal, if you're 160 and you want to be 150, you should be intaking at least 150 grams of protein a day, which
And
is
that's a
wild.
lot.
It's a
That's a lot.
lot, but think about 3 protein shakes. There's a protein
Yep.
shake out there that's 42 grams.
Yep.
And but once you get to that point where you can't put anything in your mouth from the nausea, and we'll talk about that in a second, that's the hard part. So if I was like, Mom, you're not doing what you're supposed to do. You know, I'm, of course, I supply it for my mom. I love her. I just want to take care of her. But I'm like, I'm supplying this. You're going to have to do your part in this, and the medicine will do the rest. You know, people think, oh, I'm going to take this shot and I'm going to lose weight. Well, yeah, you might, but you're also going to be sick. You're going to be malnourished. You're going to have hair loss, and you're going to lose muscle. And muscle is almost semi-permanent every single time, especially for those who are not active. So I will get them to their highest dose, make sure they're doing all the right things, make sure we're checking labs, especially, you know, if they've been on it for 3+ months, we're doing another lab draw. And just, you know, if they're not losing weight, we need to see what that A1C and that blood sugar is doing. And if it's still remaining elevated, like my mom's was, and the glucose is still over 100, then we make the switch to tirzepatide. And the moment I did with my mom, she started losing weight again. So
Did you start her on the lowest dose of
I
tirzepatide or
do,
did you start her? Yeah.
I do, because it is a dual. You know, I mean, I moved her up very quickly. I just didn't want to. I always, just like with toxin, we want to, less is more. You
Yep.
know, at a follow-up appointment with a new client, we can give that additional dose and add it in, and they don't feel the heaviness or the drop and all those things. So even with peptides, less is more. So if we can make your body do what we want it to do with just this, why add more? You
Right.
know,
I totally agree. So
and
talk about the side effect profile. Like what are you seeing the most with side effects with semaglutide?
okay, so it's important to understand what semaglutide does. Again, it's going to increase your body's sensitivity to the insulin. And we know as healthcare professionals, our insulin regulates our blood sugar. So if I have increased your sensitivity to insulin, you are now going to regulate lower than what your body is used to. And I don't care if it's by 5 or 10 points. If you've ever worked in the hospital and someone's at used to regulating at 90 and now they're at 70, they're going to be cold and clammy,
They feel
you know,
bad. Yep.
like they feel bad. And that is what happens to our clients. So it's funny that I see, oh, we'll tell your doctor to prescribe Zofran, or oh, you take that doesn't, just like there's pain mechanisms and there's receptors of pain and what can take our pain away. It is the same thing with nausea. So those same things that you might take for nausea, like Zofran and Phenergan and things like that, they're not going to help. You have to regulate your sugar. But again, if you maintain that protein level, protein is very low on the glycemic index. It's very high in fiber, so it's going to keep you regulated all day, not spiking your sugar and your insulin level up and down. But if you can stay proactive with the protein, you will not have to be reactive to the nausea. And I say that all the time in my consults, but I just want to make it stick with people, because protein is the foundation of all chemical response in your body. You know, without it, we don't function.
Yeah.
So
And for me from the patient perspective, because I was on semaglutide for a while and I did struggle getting my protein in because of the nausea. And it's so funny because it is a double-edged sword because you're like, I know I need protein, but the thought of even a protein shake
I
right
know.
now is
I know.
nauseating. And all you can think of is like maybe a little bit of fruit or maybe a little bit of this. So do you have a specific protein that your clients seem to really favor and they do well with?
Yeah, the Premier proteins at Sam's are really great, and I tell them, if you can get 3 of those in, egg whites are really great. When you wake up, you should intake at least 30 to 40 grams within the first 30 minutes of waking up. But I promise you, again, if you can be proactive with the protein, you don't even have to think about nausea. It doesn't even happen. But there's even some amino pills on Amazon. I wouldn't necessarily say they have protein in them, but they help your body to use and absorb protein more appropriately. So those
Okay.
are really great. And I do allow them to, per 30 grams is, or per serving is about 30 grams of protein. So I do allow them to add that into their protein tracker. And they do have a protein tracker, and a lot of them send me screenshots and they're like, I've met my protein for the day. Or they'll text me and they'll say, oh, I went over by like 15 grams. Is that okay? And I'm like, yeah, that's amazing.
Good
Because
job. Good job.
yeah,
Are there any foods that you tell patients to avoid or anything like alcohol obviously will make them have
absolutely.
more symptoms?
If you think about it again with spiking of the sugar, anything that's bad for you is going to increase the glucose in your bloodstream, which is going to make your pancreas react. Again, giving that insulin that you're already more sensitive to. So that's super important to understand. But even when you're on semaglutide, I feel like, I take a low microdose of 0.25 milligrams once a week. I think that it makes you eat healthy. It almost makes you crave
I
healthier things,
agree.
because it mimics that chemical hormone in the brain. It's even being used for addiction, like alcoholism and things like that. I was a big tequila drinker and I didn't drink it to get a buzz. I just loved, and still do, the way margaritas taste. And even on my low dose, I have found that I can drink it. I don't get sick at all. I'm on a lot of other peptides that help me kind of metabolize and flush things out. But even at a low dose, I don't get sick. But if you're going to pay for peptide therapy, I don't think that you will gear yourself towards eating poorly anyways. But I do have those clients that do, or I'll catch them on Instagram. Same thing with skincare. Everybody's like, the stuff's not working. But I see them eating a double cheeseburger, poured buffalo sauce over the patties with loaded French fries. And I'm like, I mean, it,
No.
it's like common sense. So the really bad thing about semaglutide or tirzepatide is if you choose to eat poorly, you're going to feel like crap, but you're also probably going to shit yourself.
That okay, like fatty foods, no, just don't do
You're
it.
done.
It reminds me of that medication from like 10 years ago. What was it? It was
Oh,
gosh.
well, even metformin does it. And a lot of people are
Yeah.
getting put on that. It's gut. But, when I see someone eat, I was like, yeah, you're going to shit yourself later. I was like, it just is what it is. It's crazy. People are like, oh, there's constipation issues. And that is true. But there's a fine line between the two, because the reason you have constipation is because it slows your gastric motility down.
Right.
But you're also increasing your protein, which is increasing fiber. So you have to drink
Why
a
Why do you think? Because I've seen two opposite sides of this spectrum, and I don't run the peptide part of my clinic. I have a couple of other nurse practitioners that do. So I'm loving this conversation. I love everything that you're saying. Why do you think? Because it does slow the gastric emptying. I have a certain population that do have constipation, and then the other side that have the complete opposite. What mechanism do you think that is?
I think it's a multitude of things. I think it's gut health in general. I have battled constipation, IBS constipation, literally since, I know you're going to think I'm crazy, since I was 7. I had a colonoscopy done at 8. I
No,
mean,
I
I was on
believe you.
Zantac 75 when it came out. I
Yeah,
have had
I had
gut
a
issues.
colonoscopy when I was 10.
Oh my
IBS
God, we
sisters.
are literally matching Brittany's. How about we just high five each other through the camera and you high five me back? That's why I love you. I love you. But it's a real thing. And I think if you already know those things when you come into the console, and I talk to all of my clients about that, I'm like, Do you already have this issue? If you do, there are some times where I'm like, oh my God, I gotta go to the bathroom. But you're mentioning people that just literally have diarrhea at all times.
Yep.
And I think that increasing their protein would definitely be beneficial to them,
Yep.
because that's going to increase their fiber. But I think the people who have constipation they're probably like, I'm going to go eat that fried food because I'm going to go to the bathroom. Like, I think
Well,
it's
because
just
you really, if you have toxic waste in your system, you're not going to feel as good. You're not going to look as good.
correct.
So we really do want to be on the other side of clearing our systems if
Yeah.
possible.
Yeah. So I tell my clients who do experience constipation already to be on Miralax. There's a really good tea. It's called Smooth Move. It's my best friend. I also do bodybuilding. So when I get into prep mode and I'm towards the last weeks, that's hard for me. So Smooth Move has been my saving grace. But it's just understanding your body. You understand your body more than anybody else. You know what it's gone through for this many years. That's another thing where people think it's just going to miraculously go away. Well, it didn't just miraculously appear.
Sure.
So that's a big thing. So I think it's both sides of the spectrum with the constipation and the diarrhea.
My super secret constipation trick hack that multiple people, women that I know
Please
that
tell me.
okay, it sounds crazy, but kiwis have so much fiber, and you have to eat 3 kiwis with the skin on.
Skin.
Less than 24 hours, you're gonna feel better. Promise.
Oh my gosh. I just tell them to go get a vanilla iced coffee from Chick-fil-A because the Lord knows we need to go. And we're like, Lord, I'm gonna go get you a
Give
coffee.
me my
Please,
espresso.
please.
Yes.
That's crazy that you had a colonoscopy. I had one at 8, was literally on Zantac 75. My appendix ruptured when I was 17. I've always had gut issues. But what I can tell you about these peptides too is they are huge anti-inflammatories. I've also kind of made myself gluten-free and dairy-free. I think as women after a certain age, we should just all say we're, lactose
Agreed.
intolerant. And
Agreed.
everybody is gluten intolerant to a certain extent. It's a man-made thing. It isn't, it causes inflammation in the body. So most foods are made gluten-free. There are so many people out there that are doing side businesses, which are great, and they make all kinds of gluten-free options. So I think just if you're super serious about your health and you're getting into peptides, you should change everything. It should not be just an injection that is going to be doing the work. I mean, that's wild to me. And
Yeah.
I'm very matter of fact with my clients. I think that's been beneficial that I was in acute rehab because, I'm like, what are you going to do? You going to lay here? No, you're going to use that left arm. Pick that left arm up and give me a high five with it. I don't
That's
want
the
the right
kind of
arm.
nurse
Give me
I
the left
love.
arm.
I love that.
So
I
it's
do.
important.
Yeah. And, from my personal experience too, I have a couple of autoimmune conditions, inflammation.
Mhm.
I have Sjogren's, which causes dryness. Like there's so many different things that were going on with my body. And the reason that I have stayed on a microdose, like you're mentioning, also, I stay on a very, very low dose. I'm on tirzepatide. So that's a conversation that we should definitely have. But it helped so much with my inflammation that whenever I came off of it because I wasn't trying to lose weight anymore, my joints started hurting me again. Like my autoimmune symptoms came back. So I am so interested in the continued research that we see for the cardiovascular, anti-inflammatory,
Yeah.
like all of these other things that these peptides are doing. I'm super interested to hear from you, like the other peptides that you're mentioning, because I know you have so many. So if you had to pick 2 or 3 of your favorite peptides aside from like semaglutide and tirzepatide, could you pick 2 or 3?
Oh my God. So I've been on peptides for almost 2 years or a little over 2 years. And I have finally found a regimen. I mean, we offer so many, but I have found a regimen that is just really great for me. My husband's on all of them. We also do TRT, so I think hormone therapy and adjunct with peptide therapy is very important. But even sometimes peptide therapy can make your hormones balance themselves.
Sure.
That's a big thing too. Everybody's like, oh, I get the skinny shot and I get this. Well, those are not going to benefit you if your body's not absorbing them correctly. So to me, they're a waste if your body's not working appropriately. So when you mention other peptides, my favorite, okay, it have to be NAD. And we have a new
Yes.
girl. It makes me feel like I want to break a table for I'm like, I feel like a Mario where I'm like
Superwoman.
leveling up. So I take it 3 times a week. And I just most recently converted to a new blend that we have, which has SS 31 in it with the NAD. And there's many benefits to that as well. But for right after I take it, maybe at like minute 1 or 2, I'm like, ooh, I can feel it right here. And I just need to stand there for a second. It literally feels like my body's supercharging. But NAD is natural in your body. And as we age, it decreases significantly, just like our collagen and elastin. That's why I'm so glad aesthetics is getting into wellness too, because you can
I agree.
relate all of this. Like every bit of it is relatable.
It's all
And
synergistic for
it
sure.
all, it all is. And NAD is just like your B12 or your protein. It is every chemical reaction in your body involves it. And of course, N and A and D all stand for this huge long word that we won't get into.
Nicotinamide, da da da
Right.
da.
Yeah, you said that, girl. But it just helps cellular function, but it's also neuroprotective. So if you were to test a person with Parkinson's or white matter, Alzheimer's, dementia, their NAD levels are non-existent. So I'm so frustrated by the government and what they're trying to do with the handle on these peptides. I mean, literally they took semaglutide and they patented it. Is that
Because
wild?
we're getting healthier, because we're getting
Right.
healthier. I'm
Yeah,
not a conspiracy theorist, but sometimes we gotta be like, okay, they're
I
taking
mean,
it a
when
little
one
too
and
far.
one equals two, it's like, come on, you know?
Yeah.
So, I mean, there's a plethora of, so NAD, of course, is, I love it, but also my melanotan and also my recovery blend of BPC, TB 500, copper. I work so much and then I work out and I do this. I need to recover. My brain needs to function on 200 at all times. I need to be able to spit something out to you. If we go back through this recording, I may have said 3 or 4 times, but my word recall, everything, my processing, it's firing on all cylinders at all times.
I can tell I need that. I definitely still suffer with a lot of like brain fog and, trying to get my words out. I actually was saying for the last 2 weeks, I've had a lot of stress. And I was like, I think I'm having a stroke because I couldn't speak. Like I was trying to talk to a patient and I couldn't get my words out, things that I would say all the time, and my
Right.
brain's like lagging. And I actually have NAD that I ordered from Olympia in my fridge. And I haven't started dosing myself. So one of my questions was like, are you doing the subcutaneous IM? Do you mix them all together? Like, what does your dosing schedule look like?
Yeah. So with NAD, it's just different. Just like with semaglutide, somebody, it frustrates me so much that people are, and if y'all are doing this, I'm sorry. But you do have nurse practitioners in the building, so you have a little bit more clearance. It's actually illegal to draw this up in syringes and hand them out to clients unless you have a dispensary license,
Right.
which is what pharmacies have, you
Right.
know? And there are some clinics that are like, hey, 25 units of semaglutide on sale for $60 this week. And it frustrates me because how are you selling this in units? This is a scripted dose. And
And
you're
we do have a dispensing license.
right, right, which a lot of people don't know,
Yeah.
or I mean, I could go on. I'm not going to get into that. I honestly am so passionate about peptides. If you're doing it safely and you understand it and you're giving the patients the education, by all means, let's give it out to everybody before the government can attack. But if you are selling it by the units and you're giving false pretense to your clients, what dose are you getting? Are you getting
Absolutely.
a 2.5? Are you getting a 5 milligram? Are you getting a 1 milligram? How many? Because your 5 milligram vial and my 2.5 milligram vial are different units.
Yep, 100%.
And that's
And
so important.
have you noticed, because I feel like patients don't take it as seriously because it's almost like they treat it like it's an over-the-counter medication,
Like a
and no
B12
hate.
shot.
No, yeah, and no hate to anyone that has messaged me or reached out, but people are like, hey, I don't want to come in for the appointments. Can you just like send this to this pharmacy and I'll do it myself? And it's like, no, you have to be monitored. You have to have labs. You have to see our nurse practitioner. You have to be weighed. We have to check your protein. Like, I
Right.
think that people don't take it very seriously because it's just one of those things where like, oh, like I can do this myself. Just give me the medicine and
Everybody's
I'll.
doing it,
Yeah, it's still a controlled medication as it should be.
yeah, that's frustrating. I get that a lot, but honestly, I haven't really felt that from my clients. They love coming in, and when I get into my new space, it'll be even better. I'm going to have a body composition scanner. I'm looking into a phlebotomist because we send our patients off, of course, to Quest right now to have their labs done. And I just want to offer again, when you're working on the inside, that all correlates to what we can treat on the outside and how your body's functioning. So I I hate that, that clients take it as a B12 injection, but it's so much more than that. And we understand that as medical professions, just like my parents thought that they couldn't eat cupcakes anymore. That's what that 5.4 and 5 or 6.4 and 6.5 meant. No sugar, but we know it's so much more than that. So much synergistically and metabolically more than just not eating a cupcake. But to answer your question about whether it's IM or sub Q, we've kind of found a dose because we do script them on such a vast population, like the other peptides, on a dose that's just really good and beneficial to everybody, no matter your weight or gender or whatever. Of course, if my husband could probably take a double dose, and just like with a B12 injection, your body's only going to absorb so much. So there's just a really good dose that has been found and compounded that our clients are on. With the NAD, of course, it does set to inject IM, but when I give IM injections, I do get sore. And as much as I inject it sub Q and I get the same benefit. I'm sure if I injected it IM, I probably would get a little bit of better of a benefit. But to me, injecting it so much and being sore every day was
Not
just
worth
not
it.
for
Yeah.
me. So I literally have the tiny little insulin needles and I pop it in the back of the arm. And that's a big question too. Does it work better if it's in the arm or the stomach? It doesn't matter. It's all sub Q. But what I can tell you is different areas of adipose tissue react differently to different compounds. So if you have a client that's getting hives or itchiness or bruising like in their abdomen, tell them to put it in the back of their arm. I inject every single day and I have no pain, no soreness, no nodules, nothing. Uh,
Amazing.
so that's really important too, because what they're compounded with, whether it be B12 or L-carnitine, it's just a spritz. Like it's not enough to give you the benefit of those additives. It's enough not to void the patent that the government and the pharmaceutical companies have over these peptides.
Yeah,
Crazy.
gosh, the industry is so interesting. So how do you where do you learn all these things? Like, how do you stay updated with the research, the trends, the industry? Like, there has to be obviously somewhere that you're doing all this research to know that you're doing what's best for your patients.
I'm such a nerd. I mean,
I love
I'm
nerds.
in school, and as a nurse practitioner that this isn't nursing school. This is research, how to find the best research, how to dig apart a research article. Is it peer reviewed? Is it white papers? Like, I am so in tune to that. I just research on my own. Everything you have heard me say has been self-taught, and I'm so passionate about it. And I always tell my people, I'm like, when you're doing peptides at this level and you're compounding them correctly and they're pharmaceutical grade and they're being scripted out, you got to think of you got to pay the legalities, you got to pay the pharmacies, once you get to that level, the money to be made it's pretty minute. Everybody's in a business to make money, but when people come in for peptides, I just want to get them on what they need to be on. And if they switch over to aesthetics and that's my bread and butter, that's great. And most of the time they do.
Yeah,
But if you're looking to get into peptides to be rich, it's not there. Um,
right.
so
But
I
if you have them on a whole entire care plan, they feel better, they look better, they're showing
they
up better
want
in
to
their
do things.
life.
Yeah.
Yeah, that's, just quality of life in general.
Yeah.
It's not that fun to look pretty if you don't feel like doing anything.
Correct. That's what I tell my clients all the time. That's just like when they come in and they're doing this, but they want lips. I'm like, no, I'm not giving you lips because
We need
you're
the
gonna
foundation.
you're gonna still be doing this and you're not gonna
Yes.
be happy. So
Yes.
I can give you a facelift, but I can also give you this that's not gonna make you have a heart attack or stroke maybe in like 3 months.
Yeah. And you're going to have more collagen and elastin and your skin's going to look
Everything.
better. Even with hormone therapy for people, the change in their skin quality, it can be
Yeah, yeah.
significant.
It is super significant because when your estrogen levels, I God, that's a whole nother conversation with hormones.
We'll have
But
another podcast. We're going
it's
to talk about
important.
hormones next time.
It's important. But gosh, I feel like we have squirreled all around this, but I feel like
I
it's
love
been
it.
a great conversation. If
Do you,
you give me the chance to talk about peptides, I'm all in.
no, I do have one more peptide question. Is there anything other, because I know NAD has been talked about. I feel like anytime that a Kardashian does something, people are like, oh, let's talk about it. But NAD,
I
you've been
don't
doing
even
for
look
a
at them.
while. I know, but I
I
feel
don't,
like patients will come around and ask for it more,
yeah.
like the celebrity talk. But are there any other up and coming peptides that you've kind of been like thinking about, like you've been seeing some research on that you haven't like dove into yet? Have you seen
So
anything up and coming?
yeah, one that I take a lot, actually every day, and I have been for almost a year now, is tesofensine, and it's actually a capsule. So it's a powdered capsule, and I take it daily. So if you have ever heard of tesofensine or know what it is, it was typically given to Parkinson's or Alzheimer's patients because it's a neuroprotective peptide, but it actually increases your dopamine and serotonin levels in your body. Okay. And
Whoa,
that's,
I need
I know,
that.
I know, it's amazing. This is why I'm like this all the time. But if you know Parkinson's and Alzheimer's, if you test their levels, typically their dopamine and serotonin levels are very low. But
Yes.
when you have such significant levels of dopamine and serotonin, you produce a feeling of satiety or satisfaction. And these people don't need that because they are already at risk for malnutrition and not eating enough, you know. So they're actually trialing it as weight loss because it does create that level of satisfaction so that you don't overeat. So that's one that I've been taking. And I have put a couple of my clients on it. It's not like on our mainstream of what we script out, but if they're wanting to come off their SSIRs or something like that, and want to come off Zoloft, they can wean off their Zoloft with their physician, but add in the tesofensine because, of course, we don't want them to have serotonin toxicity.
Yeah, that's
The
amazing.
real thing, and you just feel good all the time, but it also is an appetite suppressant. So I think that's a big one that's up and coming. So they pulled it from trial on Parkinson's and Alzheimer's patients and actually have it on trial for weight loss at the moment. That's a really cool one. Melanotan, I take it. I have a couple of my clients on it. It's not like mainstream. I think people are weary of it because they're like, well, I don't want to like increase my risk of cancer, but it actually does the opposite, you
Yeah.
know? So, I mean, you don't see many fits 4 and higher getting skin cancer,
Do
but
you
that's,
see this very white skin? I could
I know.
definitely use a
I wish
little extra
my
glow.
husband, my husband left with my 5-year-old to go pick up dinner, and he's on it, and he's a redhead, and he's tanner than me,
Is
which
he
is
really?
which is weird to see because he's got like blonde eyebrows and red hair. Most of his body is freckles, but he's got a really good glow tan
I love it.
under.
I need to see a picture of him.
You'll see it in Vegas because he's ready.
Oh yeah, okay,
We're
awesome.
all ready.
So as far as getting in touch with you, like do you do telehealth for patients? Like could they contact you and what is
Yeah,
the best way for them to contact you?
definitely. We offer virtual and in-person consults because we can treat all over the United States, all 50 states. God, I hope I said that right. It is 50 states.
You're good, girl. You're good.
I don't know why I always want to say 51, but we're good. We're good. So, yes, we can treat all over the United States, and we basically just script them out and it's delivered to you. It's scripted to you. It comes with the instructions. It comes with all of the needles. It comes with little QR codes that you can scan, and it shows you a guide on how to inject. But again, we do the virtual calls just like this,
Yeah.
and we talk about their problems. And then now that I have my nurse practitioner that I have hired, she is able to do those consults kind of right after me and basically just confirm or review what I have recommended and then go from there so that we remain legal. And next year I will be able to script them out myself, but it's super easy. They can go to toxcology.com and they can click on book the service and click peptide weight loss in either virtual or in person.
Yes, you're so knowledgeable. So from an injector or provider standpoint, are you guys offering training for providers on peptides yet, or is that something that you're thinking about in the future?
I haven't, but we are developing. I am actually the first remote prescribing clinic of Region MD. So we are trying to develop kind of like an onboarding program. We're kind of testing the waters with me, which I've already been doing, this for so long. So it's kind of like, can they maintain the shipping and all of that? Because we always want to make sure that we're providing our clients with, I call it prime peptide prime, like if we want to get it to you as soon as possible, we know it's
Yes.
costly, we know it's expensive, and we want you to get it as soon as possible. So we're just trying to see if we elevate the level, how do we keep up? Because it's already taken off quite a bit with just adding this on. Of course, I've been doing weight loss peptide consultations for almost 2 years now, but now having a nurse practitioner that can just script it automatically and get it with the company. But I do hope to develop a program. We've already talked about it a little bit, where I actually get to go into clinics and do all of this education with them and onboard them through the peptides that we actually service. So,
There
which
would
is
be so much
literally
value
over
in that,
20. I
honestly,
know.
Brittany, because even me, like our girls had taken a couple of classes, but you're such a wealth of knowledge. Like I would absolutely pay for your services too, even if it was training my girls over Zoom or something like that. Like we should definitely
Right.
talk about that. But I know people that is such a valuable service because it does take years and years to get where you are. And just like I have with Method, like you need someone to give you like really, really good training, and that makes you a better provider long term. Like
Right.
yeah, there's something to be said about figuring it out for yourself, but if you have people that are super knowledgeable, like let's pay
Right.
you for all your big brain.
It's just crazy. When you got into aesthetics and someone was saying submental or zygomatic or glabellar, you're like, oh my God, how am I going to remember all those words? And then it just like, it's
It's just there
wild.
one day.
It's wild. I mean, I could sit here and just rattle off words that I didn't even know I could say. And now with peptides, I just, I'm so focused on them and how they benefit the aesthetic industry, but I more so want people to do them safely. You
Yes.
know, even with some of the products that I inject, and I'm very selective with products that I inject and why I inject them. I mean, there's a reason behind all of it. But that's definitely something we're looking into. And, I'm going to Aesthetic Next this year. Are you going? I love Aesthetic Next.
I love Aesthetic Next. I chose to go to AES in Miami in a couple of weeks
Okay.
instead. Like I couldn't do them close together. I'll actually be in San Diego for an Allergen Train the Trainer. It's the new temple indication. And so it overlaps when Aesthetic
When are you
Next
going to be
was.
in California?
San Diego is I think it's during Aesthetic Next. I think it was that
Okay.
same time
I'll be in
period.
San Diego October 17th with I'm doing Dr. Sadat's cadaver course with Prolineum.
That's gonna be so good. That's gonna be
So, I
amazing.
mean, me and you, I know, and I told you this the other day, when good people meet, I mean, being in this industry, you can tell someone's vibe immediately, whether they want to learn from you or whether you want to learn from them. Some people can be standoffish, but when we met, I mean, we
It was
instantly
like,
clicked. It was instantly clicked. And I learned so much stuff from you all the time. I watch all of your reels and your videos, and I'm super proud of you. And I know what we both have kind of trials and tribulations and things like that, but we ultimately want what's best for our clients and our patients.
yes,
I think we just want to change the world, you know?
yes. And we
And
are one step at a time, one needle poke at a time.
that's it. That's it. I'm like, people come in and they're afraid of a needle. And I'm like, God, I literally stab myself in people all day. Like that is what I do all day. When I'm
This is what I
cannulas
live
in
for.
someone's face or butt cheek, and I'm like, I am on the butt cheek. In my head, I'm like, who are you? Like, like, how did this happen?
And they come back and ask us to do it again. Like that's the
Again
crazy
and
part.
again and again, So it's great. But I'm super proud of you, and
I'm
I
so
hope we
proud
can
of
do
you
this
too.
again. This has been so great.
It is. We're gonna have to do this again because I want to kind of dive in more in the future about like what it's been like to open your own business and talk more on hormones and do some other things. So, and we have such good energy together, so we're definitely gonna do this again.
Yeah, I feel like we just talked on the phone. This is
We
great.
need to Zoom more. I feel like we need to have more Zoom hangouts. Like this needs to be a more
I do
regular
too. This was
occasion.
good. I
So,
feel like, we're going to Vegas tomorrow. This is my Friday. And,
yes,
you know, I had a pretty good schedule and I had one reschedule and I had like a 25-minute gap and I heard a knock on the door and I was like, come on in, Debbie, or something, because I thought that's who it was. And this lady comes in and she's like, I just want some Botox, and I was like, well, I have Xeomin. And she just got off the plane from San Diego and she came and found me to get toxin.
that's amazing.
So
Hey, that's awesome.
I'm like,
You've grown so quickly, and I like you're saying you're
you
proud of
have
me, but I'm
too.
honestly, I know, like we're proud of each other. It's so great, and I think that a lot of it does have to do like I'm not I'm very like what you think about, you bring about, I feel like
Yes,
the
yes.
positivity just it brings so many good things to our lives, and helping others and educating and being kind, just it makes
A
my
good
life so much
person,
better.
being a good person,
Yes,
being a good person.
100%.
And I will tell you, I'm super passionate about my God. I love him so much. And I'm telling you, once I gave into him, both me and my husband together, the blessings have been abundant. And there's no coincidence in that. And I just thank him every day for the opportunity to be in people's lives. And whether it's yours or all the people
Yes.
that are going to watch this, I don't want to get emotional or start preaching, but
Hey, preach, sister. I love it.
girl, it's been so overwhelming. And people have come into my life and we cry in my room all the time. And aesthetics is so much more, I tell people all the time, than smoothing your forehead or plumping your lips. Like I could care less if you come to me for toxin and filler. And that's wild to say, to not, I'm not appreciative of it. It's gotten me to where I am, but the stuff that I do now is so much more valuable than that. And God has just given me the knowledge and the will and the energy and just everything to do what I've
Yeah.
done. And I'm not done yet. So when I
Yeah.
open that 3,500 square foot building, I want you to be there. Um,
Please, I will definitely be there. I'm going to do everything I can to be
we're
there.
gonna we're gonna do cartwheels in my room because I made sure it was big enough to not bump into anything around me.
I might have a
So,
little bit of envy because I have a very small room, but you know what? I have growth
girl,
plans, but I will do the cartwheels with you 100 times.
yes, yes, I'm so
Awesome.
excited.
Yes, thank you so much, Brittany. This was so much
Thank
fun.
you.
So again, tell them one more time where they can find you on Instagram and on your website.
Yeah, so I am based out of Columbus, Georgia, and you can go to toxcology.com. You can follow us on Instagram also at Toxcology, and the services are there, all the pricing is there, all the information is there. I am very upfront with that. We know aesthetics can be expensive, but it also can be affordable if done correctly, and it's an investment into your health and your life. And again, while toxic might have a negative connotation, many toxins are very beneficial.
Yes. Thank you so much. This was so much fun. Have a fabulous night.
You too. Bye. Love you,
I'll talk to
girl.
you soon. Have a fun time in Vegas.
Bye.